Hey everyone, Luke here with the Joint Replacement Therapist. Again, staying on the topic of deadlifts and deadlift technique and some ways you can incorporate deadlifts into your prehab before surgery or rehab after your surgery. So today what I want to talk about is a couple techniques for your feet and leg position when you begin your deadlift. So I'm using the barbell today, but this is going to apply to any way that you use it. If you're using a kettlebell, dumbbells, same principles are going to apply. So one thing I like is when you're doing deadlifts, something a lot of people recommend is actually doing them barefoot. And the reason for that is you have a heel in shoes, there's a lift in the heel that's actually going to bring your body forward a little bit and throw off your stability, throw off your power when you're actually performing the deadlift. So you want to be barefoot or wearing minimalist shoes ideally. If that's not possible, if you may not be completely stable, that's alright for right now, but it's a good tip is to be barefoot. For your starting position of your feet, one of the best ways to figure that out is, so ideally you want to be about shoulder width apart or a little bit more with the toes pointing forward or a little bit out to the side. So one way to figure that out is I like people to just be in a standing position and take a nice little jump in the air and see where your feet land. And that's usually